Yeah, there you go. Good afternoon, everybody. Thanks for being here. Today we have the mayor, Ben Walsh, here today with us as well, and Dr. Gupta. She's going to give out some Thanksgiving recipes. But let's go through the data. It's a busy day. We'll go through everything that we know, and certainly there's still some things that we need clarification on from earlier today. But no new deaths over the last 24 hours, so we're pleased with that. Looking at tests, we received 7,766 tests back. Our 7-day average is at 3.6%, and the 7-day average has really gone from pressing 4% down to 3.6%. So certainly starting to stabilize, and we need to keep it going that way. Hospitalizations, 107, that's up 5 from yesterday. Certainly those who've questioned the impact of this virus certainly should not any longer. Their talking point was always it's about the hospital beds, it's about the ICU beds. Well, we have high hospital bed usage, we have high ICU bed usage. We get an update daily now on that, and certainly we're not at a critical measure at this point. And there's certain hospitals that have more capacity than others based off of the type of calls that they're getting and the type of procedures they have to perform. But overall, it's something that as a community we should be concerned about, and we are. When you look at overall cases, we now have 9,009 cases since March 16th. That's up 199 since yesterday. That's a daily positive rate of 2.56%. Again, that's a good positive rate where we've been. We'll see if we can stay in that range this week at all. Hopefully we'll have a couple days in that range. When we look at the 199, there's 35 cases related to higher ed, 28 cases related to K through 12. Again, a K through 12 case is reported regardless of your child is sick going into school, or if you are a worker and you never go into work that day. If you work in a school building and you become positive, you're going to get reported into this data. That doesn't mean that there was 28 different quarantines driven from each case. Looking at the breakdown, again, 86 community spread, 4 travel, 7 senior facility, of which 5 of them were staff, 112 still being investigated. We now have 1,800 active cases. That's up 8 from yesterday, which means we had 191 recoveries, so we're very happy with that. Looking at the cases, who they've impacted by demographic, 4,831 female, 4,166 male, 1,321 under 19, 2,190 in their 20s, 1,257 in their 30s, 1,066 in their 40s, 1,237 in their 50s, 854 in their 60s, 509 in their 70s, 371 in their 80s, and 204 in their 90s. Going over our testing sites that we partner with, for symptomatic exposure, we want you to go where we manage the regional market F-Shed location Monday through Friday. Again, if you're symptomatic and you can't pre-register for an appointment there, you can go to the Syracuse Community Health Center, Krause, Upstate, your doctor's office, St. Joe's. There's other sites available. Again, we ask you to pre-register. That's how we can get to more people. If people are pre-registering, at less time per test. How do you pre-register? There's 2 types of tests going on here, symptomatic. One's related to K through 12. That's the saliva test. You pre-register for that at mychart.upstate.edu. Again, this is a popular test for children. It's not your full-blown nasal swab. It's a saliva test. So again, there's a little bit, you never get right in the next day. You need to pre-register. We do have symptomatic testing for anybody. Also there through Cayuga Medical with our partnership there in Essentia Health. I want to thank them again for their partnership. ongov.net/Cayuga Medical. Pre-register for an appointment Again, that's Monday through Friday, 9 to 1. If you're asymptomatic, we don't test there. You can pre-register over at the On Center. For those of you who came here today, you can see it in action at the On Center, covid19.ongov.net, 9 to 4, Monday through Friday, 10 to 2 on weekends. This is for asymptomatic testing, and it is a rapid test. We have over 480 of them being done here today. Yellow zone school testing, we're almost done with this for this week. This essentially what we found with all of our school districts that were in the yellow zone. We've been doing the 20% school testing, essentially because of the low positivity rates. These districts are testing out of yellow zone school testing moving forward. Today, we were at Corcoran High School, H.W. Smith, Salem Hyde, Syracuse Latin. I know we might have a couple students from there here today. Van Dyne, Elmcrest, Henniger, ITC, Lincoln Middle, Oasis, Liverpool Elementary, Morgan Road Elementary, Liverpool High School, North Syracuse Junior High. To give you an idea, that we did 1,690 tests today in those schools. We had 5 positives. I'm good at math, but I'm guessing that's about a 0.025, 0.02% positivity rate in the schools. Again, very safe for them, much lower than the positivity rate in the community. Again, part of our response to what we're seeing is getting the school-based testing so we keep our schools open. Now it's getting into the communities that are seeing pressure with positivity rates. The positivity rate, think about this, if we're just testing sick people, you're always going to have an elevated positivity rate. So to get an idea of where the rate is in the community, especially if we're being held to a zone standard, we need to get out into the zip codes, into the community, and we need to test anybody who lives in these areas so we get a true sense of where the rate is in the community, not just the 10 people who have COVID symptoms. When you look at that, we are now going to be this week testing in partnership with the City of Syracuse and the mayor at 13204 zip code Hamilton Street Boys and Girls Club, 201 Hamilton Street. This will be Tuesday and Wednesday, 10 to 4. And the second location in partnership with Mayor Walsh and his team, the 13208 zip code McChesney Park, 2308 Grant Boulevard. Again, these are for residents of these zip codes for Tuesday and Wednesday. On Wednesday, November 25th, we have 2 sites in the suburbs. Fayetteville Village Hall in the village of Fayetteville in the town of Manlius for zip codes 13066, 13104, 10 to 4. Again, asymptomatic testing for a rapid test. And then in the town of Cicero, the North Syracuse Community Center, 13039, again on Wednesday from 10 to 4 for that testing as well. We are going to have the pre-registration for the appointments on our covid19.ongov.net link. We'll be doing each day about 150 appointments per site each day. So this is phase 1 of that. Next week we'll expand this or move it around depending on where we're looking at these other zip codes. We'll work with the city and we'll work with other zip codes in the towns that are having challenges. I'm going to bring the mayor up here in a minute, but again, obviously the big news today is parts of the county transitioning. We have parts of the county transitioning to a yellow zone. We have parts of the county that have transitioned to an orange zone. The mayor and I were on a phone call with the state. Certainly, in my opinion, we wish we had a couple more days of data before we had this transition. We think the testing that will be done over the next few days will give us a clearer picture of what this looks like, but that is what it is at this point. So we're going to move forward, and we're going to work to stabilize the spread in the community and lower the spread to get us out of an orange zone and then eventually out of a yellow zone. So what does an orange zone mean? An orange zone, and again, let's see here, there's parts of the city that is in an orange zone, and we'll go over this with the mayor too. And then there's parts of Linkcourt, the town of Linkcourt and Salina, parts of DeWitt, which looks to be Jamesville, and then I believe it goes into Solvay as well. So in an orange zone, worship, 33% capacity, 25 people maximum. Mass gatherings, 10 people maximum, indoor and outdoor. Essentially, gyms and personal care are closed. Outdoor dining only, 4-person maximum per table. That outdoor dining is, hopefully we can get some of it over the next few weeks, but certainly weather will determine that. Schools go remote for 4 days and then can reopen. And I know the mayor will talk about the city school district, but we'll talk to the Linkcourt School District superintendent today to figure out what they want to do. But essentially, Wednesday, schools shut down anyway. So Wednesday, Thursday, Friday, Saturday, Sunday is more than 4 days. Hopefully we're testing in Linkcourt on Monday, and the kids are going back to school. The districts that are moving to a yellow zone, it looks like we're going to have parts of the CNS. The other parts of CNS, looks like we're going to have parts of West Genesee. It looks like we're going to have Manlius. It looks like we'll have parts of Jamesville DeWitt going into a yellow zone. We'll set up the necessary testing to continue the in-person learning like we did for the other districts. At this time, I'll ask the mayor to come up and say a few words. Mayor?
Thanks, County Executive. Good afternoon. I just wanted to touch on a few points that the County Executive spoke to. The fact that most of the city of Syracuse is in an orange zone is obviously very disappointing. I chose our conversation with the governor's office today to focus on a couple points that I just want to touch on here. First is schools. As you heard from the County Executive, we have been testing in schools, including in Syracuse City schools. And the testing has gone very well. It's gone very smoothly. We've had our firefighters in there helping out with county staff, and the numbers are good. And so we're very encouraged by that. We want schools to stay open. That is what's in the best interest of our young people, as long as it continues to be clear that they are not sources of spread. And up to this point, the data suggests that they are not. It's in the best health interest of our kids, and certainly in the best educational interest for those families that choose to send their kids. So I've made it clear to the governor's office and to the superintendent that we're going to do everything within our power to keep our schools open. As the county executive mentioned, the fact the timing is actually good for schools, in that after tomorrow in the Syracuse City School District, they're closed the rest of the week, and they don't have to be closed for 4 school days, just 4 days. So we actually have 5 days until Monday. We have some follow-up conversations scheduled with the state to clarify some of the testing requirements, but I've told Superintendent Alisea to prepare for being back in school on Monday. That's the goal. That's what we're going to work towards. Additionally, we heard about some of the businesses being impacted by the orange zone. Again, we all pride ourselves on being data-driven. And clearly there have been some businesses where we've seen issues of spread, particularly at bars and some restaurants. But a number of the other businesses included as non-essential in the orange zone that must close, namely salons, barbershops, gyms, fitness centers, it does not appear have been significant contributors to spread. And so I asked the governor's team to reconsider whether or not those businesses should be considered in the orange zone for foreclosure. I think that that's worth exploring. We've been at this for a long time. We have a much better sense now than we did at the beginning of what does contribute to spread and what doesn't. And while we always are going to prioritize health and safety, we want to be smart about it, and we want to minimize the impact on our young people and on our businesses. So that's the goal. As a reminder, as the county executive said, we have testing in 13204 and 13208 starting tomorrow at the Boys and Girls Club at Hamilton Street and at the McChesney Park Magnorelli Center up on Grant Boulevard. We encourage those living in 13204 and 13208 to take advantage of that asymptomatic testing. As we head into the holiday, I don't think there's any other way to say it. It's been said many times, but now is the time to be safe. There will be future Thanksgivings, there will be future holidays, and so everyone heading into Thanksgiving, I encourage you, I implore you to be safe. Wherever possible, just celebrate with those within your household. Do it for yourself, do it for your families, and do it for the young people that we want to see continue to be able to go to school and learn. With that, I'll turn it back over to the county executive, and I'll be happy to answer questions at the end.
I want to thank the mayor for his partnership in this process. It's been a long run here. To give everybody a macro picture on kind of where we see things, and we'll bring up Dr. Gupta to highlight a couple concerns that she has, is we go into a yellow zone when cases are increasing 90% week over week. Now, from week 2 in November to week 3, we've somewhat flattened that caseload. Cases increase less than 9%. Where if you look at the increases across the state, that's better than average. Our positivity rate is stabilized and inching downward. So I feel like we've made up some ground here, but there's a lot at risk. And to the mayor's point, with what we have in front of us, a lot of the pundits, a lot of the experts in the medical community, epidemiologists, are all suggesting that we are going to have a tough go at it if we don't quickly change our behavior going into what normally is a time where we enjoy each other's company and are getting together in a very large way with Thanksgiving. I think this community is ready to defy the pundits and to do the right thing. We're going to modify our gatherings. We're going to learn from what we've been going through for the last 7 or 8 months so that we won't see the Halloween surge happen again, and so that our hospital rates can stabilize. And that's what this is about now, folks. It's about making sure that our sick in the community, not just COVID-19 patients, can get into the hospital and get the care they need. The car accident, the heart attack. And we're at a point with hospital numbers where we never got to the point where some of our peers throughout New York State in the first wave. We don't want to get there in the second wave. So saying that, I want Dr. Gupta to come up, and Doctor, come on up and share some thoughts with us.
Good afternoon. I'm here today to highlight some of those concerns which County Executive has continued to bring in front of you for last several months. I have been here periodically, and also Mayor has raised great concerns about that. Data speaks the volume, right? We know that I used to looking at those numbers from 19 to 20 to 30, then they became 50. Now we are in 200 and more, hovering more and more. And that shows that how many more cases we have in our community, which is sort of reflective of the rest of the country too. Data does not lie. We had less numbers because of people's efforts by participating in taking care of themselves, staying home when they were sick, wearing masks, and going for testing and making sure follow our isolation and quarantine. However, there is a COVID fatigue, which you have heard. County Executive talked about that also in the past. Yes, but the virus, of course, is not fatigued. This is an enemy which is out there, which we can't see it. It can come and get us at anywhere, so we really have to be watch out. The only protection we have at this point is us. And I have said it several times, like if you're sick, stay home. If you are, and when you're going out, make sure you wear your mask. And also frequent hand washing. I think it's very important, and use of hand sanitizer. As we go into the holiday season, more and more the concerns become more significant, because those 200, do we want to go to see those numbers go backwards, down, flatten the curve, which they have been sort of staying there for a while, or depending on what people do in our community, they can go logarithmically further, escalate it and further. So a lot of it is power is in people's hand. What we looked into the Halloween parties when people they didn't have to be huge parties, small gatherings, 5 or 6 or 7 or 8 or 10. And if people are not being careful about who they're associating, who they are sitting down together, those small gatherings can escalate into further, because these same people go to work, you can imagine, and then they continue to spread to their friends and families, and we have seen people lost their lives, which is so unfortunate. This is what we have seen in our increasing hospitalization rate at this point, more people in critical care, and we have reported more deaths on a regular basis again, which is unfortunate, which we don't want to. So my biggest ask at this point will be, as we are going into Thanksgiving and Christmas in next few weeks further, is please just pause and make sure you think of today, enjoy your friends and family, and think of the next year, how good that would be. There's so much hope at this point. Other than which we didn't have any treatment. A treatment has been approved. Vaccines, you are talking 3 vaccines are on the horizons from 3 different companies, which have good efficacy. There is a hope, and that's what we need to think of as we go into Thanksgiving. Yes, you will have less gathering, less friends and family at this point. You know, you are going to feast. Of course, I am planning my whole feast the way I always did. But I will have my daughter and my husband and 3 of us. My one daughter is not going to be coming home. My niece and nephews who used to come, I told them not to come. We will do some Zoom meeting. That's fine. That Zoom call and Zoom gatherings, and we'll just hang out together. But they will be next year. And the reason I am asking it, that's something. And my in-laws, I told them not to come. This is important. This is important to me. I'm a cook, I'm a mother, I'm a daughter-in-law, and it's just very hard. I get it. But I want them to be good next year. So I'm asking everybody to do the same, because we don't want to see empty chairs. You have heard this phrase. So I'm asking everybody to take time to see how do they want to celebrate their holiday for next year, by making sure that when you go out even shopping with your friends and family, use your mask. Don't leave home without mask. Make sure if you're sick, don't go to work. If you're feeling you could be sick, or sense of kind of not sure that if you have been exposed, get tested. There's so much testing available in our community. That's how we find the cases, and that's how we quarantine. That's what I wanted to come and tell you, that I see the data at the back end. The workplaces are doing everything in their power to keep their workplaces safe, whether it's a school, whether it's a manufacturing, whether it's a restaurant. There are people bringing those viruses towards them, whether it's a worker, whether it's a customer. So it's individual responsibility. At the same time, the public health non-pharmacological intervention we call hand washing, stay home, use your mask, and just take responsibility that you want your loved one next year. And there will be vaccine soon, and we will be talking about more and more vaccine in the future. So stay tuned, more good news. So there's a hope as we go to the end of this year. So thank you.
Thanks, Dr. Gupta. And to that point about a vaccine, we've already put forward plans. Dr. Gupta and her team have put forward a vaccine distribution plan to the state. We've been on calls with the CDC, calls with the governor's team, and certainly the administration in Washington, D.C. at the White House, as well as reaching out to counties as well. So this is real, but it doesn't mean we don't have a fourth quarter to play here in this pandemic. And so we need to finish strong. Saying that, we'll take questions.
Ryan, when do the orange zone restrictions start?
So for businesses, they start on Wednesday. So we're getting clarification, but we believe that means Tuesday at midnight, Wednesday. And then schools, obviously, the schools aren't in session Wednesday anyways. So that's going to start that 4-day period of time for the orange zone schools.
So potentially the schools don't miss any time.
Correct. What we're working out is there's two districts really, three. The Solvay, some buildings in Solvay School District, the Lincourt School District, and then the City School District. Lincourt is a very small district. We'll be able to do that testing in a day if we had to test everybody. The City School District and Solvay just graduated out of the testing protocol for yellow zone, so we don't believe a new orange zone protocol makes a lot of sense. So we're working through that. Again, nobody's been in this boat before, so hopefully we'll continue a testing protocol in the city and Solvay school districts, and that will be enough instead of having to test every single child going back into the building.
I'm wondering if you could give us some insight into the orange map. What exactly are we looking at in terms of boundaries, zip codes, full towns or cities affected? Do you know? It's hard to, businesses are having a hard time figuring out
Correct.
if they fall into this.
And we recognize that, and as we get more information, we'll share that. But I'll go through some zip codes that I believe are in the zone. And again, there are some clarifications that I know the mayor and I are very interested in that we're waiting on. But when we look at the orange zone zip codes, looking at 13203, 13204, 13205, 13206, I believe parts of 13207, 13208, which goes into Lincourt, 13209, which is the village of Solvay, 13210, which is the university neighborhood, and then parts of 13215, but I don't believe that's in the city part of 13215. So it gets a little murky with some of these other ones, 13224 in the city and the east side. So we're working through some of the clarifications on the map. We saw the map this morning. We had the mayor and I spoke to the DOH about it, and we've been having weekly calls with DOH going over the map. Again, the positivity rate is what they're looking at for each zip code. So sometimes when you have a zip code that is a big area, you might have a problem on one end, not on the other end, and it's very difficult to work through that. So that's why we're taking our testing approach into the zip codes to get a better sense of what's going on in the community and to see if those rates are true. The more testing you do in those zip codes, the more you'll find out if those rates are true. And if they're true, then the zone's merited.
The governor was very rejective of county data in his briefing yesterday. He says county data is irrelevant. Today, his infection rate for the orange zone is 4.99%. Do you know where the state is 4.99%? Do you agree with it? Do you disagree with it? Or is it just a dated number?
It's just a number at this point, so I'll agree with it. That number won't be there in a week from now. I don't know if it'll be 4.88%, Andrew, or whatnot. But once you do more testing in there, it moves the numbers. Look at our 7-day average. It's going down. When you look at even the yellow zone numbers after a week, I think it started in the sixes, high sixes. Now it's down to the low fives, maybe. So the more and more testing you can do, you get a better, really a better idea on where those numbers are in the community. But I think a couple things. There's whether the rates are driving the zones, right? The 200 cases a day is what's driving the hospital numbers. So the zones are the economic side. The daily cases are the medical infrastructure side. So we can't preserve all of our medical infrastructure in the long term if we don't do something with the daily cases. So that's where hopefully some of the mitigation, that's where people listening to what Dr. Gupta has to say related to modifying some of their behavior now, that will catch up with that. And then those numbers will go down. And as those numbers go down and testing goes up, then some of the restrictions go away. And that needs to be our focus, is that we have a role to play, and if we all play it, some of these things will iron themselves out and will be quickly in zones and out of zones. If we don't listen to Dr. Gupta's advice and others, then this might be a longer process. And then that limits some of the things that we like. We all worked very hard to have an economy open that was growing, unemployment rate dropping. We got a lot at stake here.
With some of those transitions in the county, what specifically are the new areas that are now in the yellow zone?
Manlius, Cicero, we talked about those last week, that those were borderline yellow zones. Parts of Camillus in the Fairmount area, parts of DeWitt in the Jamesville area. And so you got east, you got north, and you got a little bit west.
So that's the entirety of Manlius, but only parts of the...
It looks like it doesn't have all DeWitt, but a chunk of it, and all Manlius, and all Cicero, and parts of Camillus, and a little bit of Onondaga. The town of Onondaga goes through there as well.
So the school testing in the orange zone, what metric, what percentage you need to test in an orange zone, and how do you determine if they meet the test out option to reopen?
So my understanding is you don't get out of, if this was day one, school district goes into orange zone day one, we would test every kid for in-person learning. And then we would do the 25% or 20% on a weekly basis. Now what's different here is we were in yellow, parts of yellow went orange. We already did the 20% testing, which once you prove the positive rate is lower, which it was very low, then you graduate out of that. So now we have districts that have graduated out of that going into a new zone, not because the school districts did anything wrong, it's just the general positivity rate. So we're getting clarification on that. Our hope is that we'll go forward next week, we'll continue just doing the 20% testing via all the districts.
I think Mayor Walsh mentioned too that you're hoping maybe to get some relief for barbershops, salons, gyms. Is there any chance that'll happen by Wednesday?
I don't think we should be planning on it. I think I agree with the mayor. When you look at, when you've had 9,000 cases, you can point to a case for everything in the community, right? To the mayor's point, what isn't driving spread or clusters are those specific industries, where in the beginning the thought process was, when we were doing restart, the thought process was anywhere where you had people congregating, that would be more risk, so they would go later phases. That's why it took so long. What we've seen, schools, gyms, some of these other personal care, when you wear the right PPE and you do the right things, and you sanitize and you distance appropriately when you can, it's more of a controlled setting. It's actually a safer setting. So certainly I agree with the mayor that hopefully the state will look at some of the businesses that are being impacted and they can modify some of the approach or make us go test in the businesses. Let us go in the businesses and test and see what the positivity rate is. If it's less than the community themselves, treat them like schools.
Do you have the infrastructure to test all those businesses and the schools?
Yeah, we're doing asymptomatic testing here at the On Center, right, where people can sign up. We're going to the community where people could go. We will continue to do what we need to do to keep schools open and to keep the economy open, and certainly and give Dr. Gupta and her team the resources they need to do their job. Our team has always met the challenge, and they'll continue to meet it.
How many of those rapid test kits for asymptomatic people do you
I would have to get a number on it, but certainly we're doing over 2,000 today.
Destiny USA is in the 13204 zip code. What effect does the orange zone status have on Destiny USA?
They actually have their own zip code, so I don't know what their zip code is not on our list.
Their mailing address is 13204. But
Yeah, I think we have, they actually have a physical zip code, much of it. I'm not sure how that breaks out, but certainly if they fall into that category, no in-person dining, no gym, no more haircuts. That doesn't mean you can't go shopping.
So when it comes to these specific areas, how frustrating is it for you or for you, Mayor Walsh, to not really know from the get-go what specific areas are impacted or whether or not schools will be able to continue to operate without this new testing requirement?
I'll talk and I'll let the mayor respond, but this is an evolving crisis, and you come into every day knowing that something's going to happen to you that day that you didn't expect. So that happened on Monday morning, and now we move on and we react and we try to get in front of it. Much of the zip code testing that we're doing now, that was in the works. That's why we were asking for a couple more days before we make this move, because we're already going to do this. And so now we move on and we work collectively to try to get ourselves out of an orange zone and then out of a yellow zone, because we know if that's happening, that means our data going down, and if the data goes down with new cases, the hospital beds will go down. Mayor, do you want to jump in on that?
To the county executive's point, more time is always better, and I think that what we spent some time talking about with the state is that overall, since we've gone into yellow, we've seen improvement. It had its desired effect in that it got people's attention, and so our inclination was to try to continue down that path, and hopefully the numbers would continue to go in the same direction. However, what the state would say is that may be true, but if you look at the specific zip codes that went into orange, those numbers are still too high, and that's true. We can't debate that. The data is the data. Again, it's our hope that what we've been doing will continue to work, and eventually you will start to see those numbers go down. But until they do, our hands are somewhat tied. But again, that's why I think it's critically important that we look specifically at where we can have an impact on the numbers. Testing certainly helps, and the county's been great about pivoting and directing the testing resources where they need to be. But again, when you look at where the spread is happening, increasingly, it's happening in living rooms, it's happening in households, it's gatherings, and those are really hard to regulate. But and that's what makes this situation that we're in, what gives me hope, but also makes me incredibly frustrated, is that we actually can control our own destiny here. And at times we have, and at times we haven't. And so we have another test as a community, and we've risen to the occasion every time. But this is going to be the hardest one, because again, we're going into a season where it's all about gathering. But as Dr. Gupta said, think about how great it's going to be when we can gather safely. And it's not that far away. There is light at the end of the tunnel, but we're not there yet. So we just need to be disciplined in ourselves and do the right things. We're so close, but we're not there yet. So in the meantime, we're going to continue to try to work together. And I think what you've seen from the day one is the city, the county, and the state completely aligned in our objectives. Not always agreeing fully on everything, but continuing to work together. And you're going to continue to see that. And I think by and large, that's worked really well.
Mayor, the other part of the season is, of course, the cold and the snow that we're going to start to see coming in. Is the city have any plans to do anything to help restaurants try to keep outdoor dining alive, if that's their only option, like more street closures, maybe offering heaters, anything like that?
Absolutely, yeah. So a couple weeks ago, we launched our winter dining guidelines. So any business in the city should be aware of that information. If they're not, just reach out to my office. But most of the adjustments that we made in the good weather will continue on. So parklets, at least until we see a major snowfall, can continue to operate in the roadway. Sidewalk cafe seating can continue throughout the winter. We're trying to accommodate for temporary structures like bubbles, like you see in Perseverance Park right now. So we're trying to do all of that. We recently launched another grant program through the Syracuse Economic Development Corporation to provide grant funding for businesses to buy heaters, to buy other things. So the more people can be outside, the better, and we're going to do everything we can to accommodate that.
Mayor, what would you say to a restaurant owner who is devastated by this news, for that matter, salon owners, gym owners, who've followed the rules, who feel that even a single few weeks without business could be the end of their business? What would you say to them today?
We're devastated too. These are our neighbors. These are our relatives that are struggling to get by. It's heartbreaking. It's gut wrenching, and I get calls and texts on a daily basis from those businesses. All I can say is that we are doing everything we can to support them, to help them through this difficult time. And again, that's why we're spending so much time focusing in on the data to make sure that when we're making these incredibly difficult decisions that literally have life and death implications and implications on people's livelihoods, that we get it right. And we have learned a lot since this pandemic began, and as we continue to learn, we need to modify our approaches to minimize the impact. But always, always, we have to prioritize health and safety. But I can tell you from my experience, having been to some of these facilities, as the county executive said, our business community has adapted. Yes, we have some outliers, and unfortunately, we're all paying for the sins of those outliers, whether it be individuals or businesses, but the vast majority are doing the right thing. And I would just say continue to do that and know that you have your public servants advocating for you at every step.
We've heard from a lot of sheriff's offices that they won't be actively enforcing the governor's 10-person limit on Thanksgiving. I'm wondering what you've directed the Syracuse Police Department to do.
Sure. So I have directed the police department to respond to every call that comes in on violations of the executive order and, where appropriate, to cite. So a little bit of background and context. As you may recall, from the beginning of the pandemic, the role of the police department largely has been, first and foremost, respond to every call. Now, the county and the health department responds to a lot of complaints. You have the state liquor authority, but SPD has responded as well. Up until recently, when we went into the yellow zone, the approach was educate and inform, because it was working. When we went into the yellow zone, as I said at the time, that was the appropriate time to revisit our enforcement strategy. And since then, we have stepped up our enforcement strategy. So again, we're working very closely with the county and the state. The county is continuing to issue citations. The state has as well, and now the city of Syracuse is. So since the yellow zone went into effect, we have cited one business, but there will be more. Again, we're trying to share the load. But this is a time when we need to hold ourselves to a higher standard, and I've delivered that message as well across city government, and we need to hold each other to a higher standard.
Will police officers be responding to private homes that have more than 10 people if those people are tipped off by a neighbor?
If we receive complaints on illegal gatherings at private residences, we will respond. What we do will depend on the situation. If it's just somebody who doesn't like their neighbor and sees an extra car in the driveway, likely nothing is going to happen. But if we see blatant violations of the executive order, we absolutely are going to reserve the right to issue a citation.
Question for the county executive. When it comes to hospitalizations, you had said a little earlier on, I believe a few weeks ago, that once we begin to get into the 70s and the 80s of hospitalization, that's when we're really starting to be in the red. How concerning is it that we're over 100 and are hospitals having to start looking at any different procedures as we move forward?
Yeah, so we do an inventory of the hospital beds each day now with our emergency management teams and their emergency management directors. And so you're looking at upstate's 3 or 4 different buildings. You're looking at Krause, St. Joe's. Then we look at what's the capacity in the hospitals for everything. What's the ICU bed capacity? Then we look at what COVID's doing to the overall picture. And so I'll get that report later today. But certainly, depending on the ICU beds, I think we had 2 hospitals that had plenty, and we had 1 hospital that was tight yesterday. And again, that's depending on what kind of trauma situation you run into, is what, different hospitals have different expertises. So this is a situation where the fact that we're having these calls again shows that the situation is elevated. We're in the second wave. It's different from the first wave. We know more. We have strategies that we know worked first time. We implement them. But what we did not see the first time, and maybe it's just because we didn't have the testing, was the case levels, the high case loads. Now we're doing more and more testing, and we're finding these cases, but a lot of these folks are still getting very sick, and they're going into the hospital. The hospitals are better at treating the sick now. Again, 4.5 days on a regular admission, I think, but then 6 to 7 days on an ICU situation. But we're seeing these aren't small numbers in and out every day. So today, I think it was 15 new admissions with 10 discharges. And I think over the weekend, we might have had 12 and 12. So people are getting sick, and they're going in, but we have a lot of people getting better and coming out quicker. In the beginning of the pandemic, if we had this type of activity, we probably would have had a big problem because people weren't getting in and out of the hospitals that quickly.
I want to clarify the school testing. You're hoping the state will allow you to continue the 20% per week in the orange zone beginning Monday?
Yeah.
Okay. I'm wondering, picking up on what the mayor said, we're not seeing a lot of spread in salons. Some bars and restaurants were trouble that you've continually worked toward improving. Where are we seeing these cases come from? Is it living rooms? Are people still gathering?
Yeah, well, when you have 199 cases, you're going to have a little bit of everything. But when you look at trends, Dr. Gupta would tell you, because she tells me, so I can say this now and not call her up here, is that you do have a lot of living room spread. And again, these are gatherings these are normal gatherings. We all had them. We all did it in the fall. We all did it in the summertime. But as we go indoors, the virus is clever, and the virus can spread easier indoors. So
these are still happening almost 4 weeks after Halloween.
Sure. And these aren't parties, Andrew. This isn't the Halloween the Halloween evening where we know downtown was having very busy evenings, right? And we know there was lots of cases from downtown bars across the county, and there was households. But these are folks just getting together normally now, what they call living room spread, right? And remember, this is the other thing, is when you have cases like this, like 199 cases, even so you broke it out, maybe there was 20 or 30 household contacts in this. For all these new cases, where they're new cases, there's going to be household contacts that we're going to be reporting on all week from this, right? So that was always a part of this, is the household contacts. But it was never 20 or 30 in the first wave. It was 5, 6, 7, 8, 9. So that's why we really need to starve this virus in order to keep flat with all the pressure coming up. And if we really do a good job, we'll bend it. And then eventually we'll get to the point where our infection rate will be under 1 again, and then that will drive the positive rates down.
But it sounds like some people are not getting the message that the virus can spread in a living room.
Yeah, no doubt. I mean, there's some people that don't even believe it's real.
Ryan, with the addition of new school districts now in the yellow zone, how many more tests is the county going to have to coordinate a week? Have you calculated that?
So we're going to lose some districts because they've graduated out of the program, right? So those districts won't need testing next week. We're bringing on new ones. We have to get those. We'll have a call with those superintendents. We have to get those head counts of in-person learning with the staff and students per district. But my guess is that will be a break-even proposition. The big question is, will we have to test every kid from yellow to orange to let them go back to school? Because if that's the case, it will take a while. If we don't have to and we just do the 25% testing, then we can it'll probably be close to what we did last week moving forward. What we are doing more of, and we are building out more teams. We had 5 teams doing the testing. We are adding more teams so we can go out into the zip codes and get better samples in these zip codes to figure out where the positive rate really is.
Is the state continuing to support you with testing supplies?
I asked for a large number of them today. Hopefully we'll get the answer on that.
What did you ask for?
50,000,
Of the Binax?
correct.
Still on school testing, I know that, would you be able to please just list the specific school districts that you believe are going to be graduating out? And then I know that you're waiting for clarification from the state, but on that hypothetical that they turn around and say, we understand that you graduated out of the yellow zone, but we're in the orange zone now and we're going to just keep that as a blanket mandate. Do you think the county is going to be able to meet that demand, to be able to test everyone, especially in buildings as large as the ones in Syracuse?
So what we'll do then, we'll talk with the mayor and the superintendent. I'll share a conversation that we had when this all started, was that we wanted to make sure that elementary first, middle school second, high school third. I'm sure that would be the strategy we'd go for if we had to test every kid. We know having the kids in school, they learn. We know where they are, they're safe. We know they're getting fed. So there's a lot of upside for having the kids in school. And that will be our #1 goal, is to make sure every kid that should be in school has that opportunity. It's not because of a government regulation.
And then, sorry, just would you be able to say which school district specifically you believe are graduating out?
So you're going to have Liverpool out, part of Cicero North Syracuse out, but part of Cicero North Syracuse will be coming in. You'll have Baldwinsville out. You will have, who else was in our original? Solvay's still in, Lincourt's still in, the city will be in, East Syracuse will be out, but we're going to pick up some JD, right, in Manlius too. So it looks like you'll have Liverpool, parts of Cicero North Syracuse, Baldwinsville School District, and then East Syracuse Manoa will be graduating out because their positive rate is so low.
And the city of Syracuse as well?
Well, because they go to an orange zone, Solvay, Syracuse, and Lincourt going to orange zone, there will be testing. Our hope is that we're doing the 20% testing each week moving forward till we get them out of an orange zone back to a yellow. And then once they're back to a yellow, they should be all set.
Ryan, are the lines of the orange zone clearly known now? There's some confusion in Solvay, for example, whether their entire district is in it.
Yeah, I don't believe Lakeland is in it in Solvay, but they are not that clear yet, Tim. We're still, there's still areas that the mayor and I both have questions on so that we can give especially good guidance to the business community. School districts are easier to find. They got a couple buildings and they're going to land somewhere. But the businesses whose operations are in jeopardy, we want to be able to give them good information.
Have they said, there's an online lookup tool, but have they said when that'll be updated, the state?
Not yet. Other questions?
Just lastly, I know that there was, seems to be some confusion over what zip code Destiny USA is actually a part of at the state level. But if we were to lose Destiny, how big of an impact would that be on, the county's slow approach to sort of gaining back some of the sales tax that it lost?
So all these businesses in the hospitality industry, when they're limited, hurts our sales tax. Restaurants and hospitality, huge drivers of sales tax, top 5. So what you're talking about with these restrictions is gyms, barbers, nail salons, cosmetic, they can be open for selling their product but not performing their service. And then obviously there's no indoor dining. So if we'll have to look at malls. What does that mean? Does outdoor dining mean you can go in the canyon area and put seats down? I don't know. With the food court, we'll have to go through these. But essentially it looks like those businesses will be takeout only. So whether you're takeout only in Tipperary Hill or Destiny, if you had more people that wanted to go out to eat that day and they can't, and then they don't do takeout, we lose 8%, right? So all these decisions have an impact on the economy, the households, the unemployment rate, and then eventually your government's tax collections.
Ryan, do you have the number of hospital patients who are in the ICU?
Yes. I'm sorry, I was wondering if I gave you that number. 19 in the ICU.
And do you know from the Board of Elections absentee counting, have we seen any secondary cases among the many volunteers that they're observing? Is that known?
I forgot what your last count was. I think we had 9 or 10. Dr. Gupta, do you want to talk about that?
So we have not, at present, there's no cases among the volunteers that we are aware of. All the cases are among the staff members, which I think you know, and we may, I don't know how, when was the last number you have?
I think it was 9.
So there are 10 staff members, and there is two, as of today, this morning, we don't have anybody who's reported to us from the workers, who are volunteer workers, reported to be positive. They're all being tested. I have been personally communicating with the both commissioners on a regular basis and watching over it they have done a great job in terms of communicating, and we continue to do so. And will provide the all safety guidance to them as we continue to go into their opening of operation.
Was it necessary to put all the volunteers into quarantine, or only those who were in direct contact with a worker?
So as Tim, in any contact investigation, right, we look for the whole detailed description, and based on the description which was provided to us by both commissioners and their staff leadership, we put all those, depending on how the tables are set up, how long exposure in each table, how the staff were distributed, based on the CDC and state guidelines. We had no way other than put everybody in the quarantine there because of the amount of time they spend within that warehouse. That was the safest bet to do, and also recommend them testing. So yes, it was very important for us to do that.
For all of them?
For all of them, yes, yes.
Dr. Gupta, with the data that you talked about a little bit before in terms of, and both Mayor Walsh and the county executive were talking about where things have been spreading, whether it's downtown or in the living room. We're seeing very, very low numbers from the school testing that we've been doing. Would you be able to speak to what the medical rationale may be to still make school testing a top priority at the state level as we head into these zones?
So you have to think of, from the school testing point of view, is kids and teachers, staff go to the school from the community, right? A lot of them, it's a hybrid system, so what we have not seen as of it now is that there's no secondary cases coming out from the school transmission because of the active monitoring of those. Any cases come out from the school, any school buildings, and working with their staff, with the superintendent, our team identifies the cases, their contacts, put them in quarantine, and we have been able to interrupt that cycle within the school system. However, what people do outside of that building, that is what we all are talking about, is that when you go home and when you are around people, friends and family who may have traveled from outside, who may have gone and participated in some other activities with other group of people, they're coming to your living room now, so they're bringing that virus back to you. Even though you could be the safest one, but at the same time, if you have not watched who you're associating, creating sort of your own pod, that's the word which we have been using lately quite a bit, that have your own safety bubble, then you are going to get exposed to the virus, whether you want it or whether you like it or no. That's why controlling the flow of people around in your group, it's so critical. Until we have the vaccine, the only thing is in our hand is us. As I always keep on saying, is that how do we control our bubble, and how do we control who comes into our living rooms? That is very important to curb the transmission of virus.
So testing in schools, part of that is because it's such a central part for a lot of community members that it's a good way
Yeah.
to try to catch that's
Right, so
stop the spread on the chain.
Yeah, so you still can capture those because you are getting those community members so that they are coming and getting tested. But it's not indicative that it's happening within the school system, the transmission, right? So you have to look from the community perspective, what is happening in the community. And that's why it's so critical as we go into all these holidays that vaccine is there. It's a great hope which we have before the year ends, but the only thing which we have our best protection is our masks, our hand washing, staying home, and I cannot emphasize enough to all of us to do that, because we actually can flatten the curve and pretty much halt where the cases are and pretty much downtrend our number of cases. So people's power, that speaks the volume.
Ryan, in terms of, the county enforcement of business operations, are you still having to fine some companies? Is it less? Is it more?
No, so I think what you're seeing is we've had increased enforcement over the last month or so. And so SLA, State Liquor Authority, comes in. They have certain areas. Most of this is always complaint-driven, usually by people who go into these operations. The customers go in, and they're uncomfortable, and they make a complaint. Then we have certain complaints that come in. If SLA and SPD are doing these types of businesses, and we have these 50 other complaints about a corner store, a gas station or whatnot, a large retail store, then we'll go out and we'll stop by there. And certainly, I think over the weekend there was citations for sure. So that's just part of what we're doing. That's part of yellow zone, orange zone, everything moving forward. Again, when businesses follow the guidance, they have success. It's when they don't follow the guidance and the guidelines where you can see the virus transmitted easier. Mind you, all these businesses, this is the one thing too, sometimes people say, geez, you're anti-business because you'll find somebody for not following all the rules. All these businesses signed they attested to the state of New York that they would follow these rules. So we've been giving out warnings and warnings and warnings. Now you can't give out warnings anymore, right? So they made a promise to the public and to the state that they would follow the rules. So they're the ones who aren't living up to their end of the bargain. Anything else? I want to thank the mayor and Dr. Gupta again, and we'll see people on Wednesday before Thanksgiving. Thank you.